Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Hiradopoulos. Well, it's that time of year again for the flu shot, so I thought it would be a good idea to discuss your options. The flu vaccine is safe and effective and the single best way to help prevent influenza and its complications. The CDC recommends that everyone 6 months of age and older be immunized this and every year. Many misconceptions about the influenza virus and vaccine persist, despite the widespread impact of the disease and the benefits of the vaccine. And I hear all the time from my patients that they don't ever get the flu, or they got the flu from the flu shot. Well, I'm here to tell you today, you can't get the flu from the flu shot. The flu shot does not contain the live virus, so it's impossible to get the influenza from the injection. Also, some patients think that if they got the vaccine last year, they don't need to get it again this year because the immunity lasts. Immunity wanes after a year, so it's important to get vaccinated every year. And the types of influenza viruses circulating in the community change from year to year. And because of this, a new vaccine is made each year to help protect against the current strains that are predicted by the World Health Organization from the previous year. There are many different types of flu vaccines, and each have different criteria. So I brought some examples here today. The newest one is called the intradermal flu vaccine. And this one, intradermal, means it's right underneath the skin. So the needle is very, very small, almost like if you were getting a PPD for a tuberculosis check. This one is a single dose vial, which means that there's no preservative in it. It is indicated for ages 18 to 64, and it is very good for protection, just like the regular flu vaccines. Then there's a high dose one. That's for ages 65 and up. The high dose contains 4 times the amount of antigen, because as you get older, your immune system's not so good. So you need to be exposed to more antigen to develop the immune response for protection. Again, these are single doses, preservative free. These do go intramuscularly, not just underneath the skin. Then there's a FluMist. I don't have that available here, but the FluMist is the nasal spray. The difference with the nasal spray, it is a live attenuated, meaning weakened virus. So if you're pregnant or immunocompromised or have sinus problems, you cannot get the FluMist. And that's indicated for ages 2 through 49. Now, the multi-dose vials are probably the most common form. They are indicated for 6 months all the way up to 64. And up to age 3, you get half the dose. After that, you get the full dose. Now, if you're less than age 9 and you've not received a flu vaccine before, then you need to get 2 doses 30 days apart to prime your immune system. So that's the flu vaccine in a nutshell. So remember, go out and get your flu shot so we can have a healthy flu season. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.